that you absolutely have to understand as women that we have to work as one. And that's the way every session started. The plenaries, the small group sessions, everything. It also got everybody's attention. So I am so happy to be here. When Pauline says that I was hearing her angst, I was channeling her angst. I was trying to understand what it might be that I can do that would be helpful for Mother's Milk Bank. And even though I got to Mother's Milk Bank from a former employee, it was something that I have been interested in since I had worked in Africa, since I had worked at Cook County Hospital, since I had worked in medicine, looking at the ways in which nutrition affected people's long-term health. But one of the questions that was raised very, very early when I was talking with Pauline was this cycle that happens between prematurity of babies and health of mothers, and all the different technological things that we have come up with to fix and help them. How many people in this room know someone who has had a premature baby? That's everybody in the room. Okay. So you probably are aware that the rates of infant mortality are directly related to the rates of prematurity. The things that cause premature babies are multiple, but early for dates babies are born early for lots of different reasons. Sometimes because your membranes rupture early, and then those babies are important in particular because the things that cause membranes to rupture early very often are related to mom's physical health, which can be diabetes, hypertension, all of those things. Now this is important because babies that are born early, anybody know a baby that was born at 22 weeks gestational age? So babies at 22 weeks gestational age is an incredible number. It used to be if you were 36 weeks, you were at risk. But at 22 weeks, a 22-week gestational age baby born right now has as good a chance as making it out of the hospital as a baby that's born at 26 weeks. That is a miracle of technology. What it is not a miracle of is understanding how that comes to be. Well, we know with fertility choices that a lot of times babies come smaller. Sometimes they're premature, sometimes they're just small for birth weight, and they can have lived in their mom's body for long enough. There are a lot of issues that are related to how come we live. Has anybody here ever heard the word healthcare disparity, those two words?
Yeah.
Okay, raise your hands. I need healthcare disparity. Okay, healthcare disparity is where you see that there is a difference between the health in groups of people. Now, it's a complicated thing, but way back in the 1960s, around the time of the Martin Luther King march that we're celebrating this year, there were issues that began to be noticed, which is that people of color, particularly Black people and Latino people and Native American people in the United States were actually sicker than other people. So people started exploring that and figuring out things, and also figuring out the strengths that people had to get out of that situation. Well, it turns out that even though we as Black women have more babies that are born premature, we also have within our own bodies the ability to prevent the things that may be causing some portion of that prematurity, like about half of it. So when you look at the cycle of what bioethics does, it's back to bioethics. This book that we've done is called The Elephant in the Room: Bioethical Concerns in Human Breast Milk Banking. And it's a tribute to Pauline Sakamoto, whose intuition said, there's something fishy, I've been doing this for years, there's something going on here, I need some more paradigms to look at. So bioethics has brought you things like the WIC program. You don't know that, right? But when we look at healthcare disparities and we look at the way the technology and stuff has been used, it didn't used to be there was a WIC program. There didn't used to be this reality that nutrition and focus on women's health could make a difference. That came out of the bioethics community. It was an action. Oh, come here. It was an action that came out of bioethics. So bioethics is what we ought to be doing with the science and technology that we have. Not what we're doing, but what we ought to be doing. And whenever somebody says ought to you, you ought to do this, when you tell your child you ought to do that, you ought to do this, you are making a moral judgment. You're saying, anytime you hear ought or should, someone's making a moral judgment. You should do this. Well, you're saying it would be good if you do this, and it would be bad if you don't do it. So bioethics is about what we ought to be doing. Here's what we ought to be doing. We ought to be making sure that women are healthy and have healthy babies, because their healthy babies yield healthy men and women. It turns out that over the last 20 years, there's a whole body of knowledge that has been done by the Breast Milk Trends group at UNESCO, where they look at the outcomes of people who've been able to breastfeed for 2 years. 6 months of breastfeeding alone, and then the rest of the time co-feeding. And it turns out that you can provide for babies who are breastfed, you can decrease their hypertension, diabetes, and heart disease to the point where it is so minimal it's hard to discern from just natural incidents in whatever community. It also turns out, as Dr. Brooks pointed out earlier, that the mom that breastfeeds for 2 years can deal with her own hypertension, diabetes, and heart disease. This is a win-win situation, okay? You can also decrease the amount of premature births in specific communities if you have less diabetes, heart disease, hypertension. That's not the whole story, but there's a big chunk of stuff that happens there. So the elephant in the room, does anybody know what the elephant in the room means? So it's a weird thing, okay? Let's imagine that we're all sitting here having lunch. And if you look on that piece of paper, you'll see there's a family sitting there, a little perplexed, ready to have breakfast in their PJs. And there's an elephant sitting at the table. So imagine an elephant was sitting there. And everybody was ignoring the elephant. Pretending to ignore the elephant. The reality is that we have the capacity to improve the health of babies. We have the capacity to improve the health of women. We have the capacity to improve the health community by community. Latinas, Black folks, Native American folks, by breastfeeding. But what the real reality is that we are in control of that. Women are absolutely in control of that. It is the one thing that we are absolutely in control of. There is a unique situation that has happened, which is, it's kind of strange, but it turns out if you don't have a job to go to and you have a baby, you can actually guarantee your baby's health better than people who have a job to go to. Because you can take the time to do it. You can also donate milk for other babies that are sicker, better than other people can, because it becomes your job to make the world better. Well, that's your job anyway, right? So that's why you have your babies anyway. So the elephant in the room is a complicated story about how all of these things are interwoven, how we focus too much on what happens in the hospital. When the circle, if it starts with increasing breast milk donations to help out Mother's Milk Bank, and I say it in the book because I was told it, there are days when the refrigerator and the freezer is empty. The milk comes in the morning, it is distributed to people who need it on the highest level of need basis in hospitals and people with prescriptions in the community. And at the end of the day, the staff is standing there crossing their fingers and hoping that the truck gets there in the morning with enough to go for the next day. Now that is a very tricky position for an organization, many organizations in the mother's milk banking system to have to deal with. But it is a situation that women can actually help babies who are in need, but they can also help their own babies, and above all else, they can help themselves. So, if you've been maligning the fact that you don't have work or you don't have this, you do have work. If you think you don't have a job, you do have a job. The money, we don't work in terms of money, right? Anybody ever have to get your kid to, it's like you have to get them to a baseball game or something? So you kind of carpool. Three kids go with one mom and another mom picks them up, right? It's just spontaneous. Nobody tells you how to do it. Well, this is that sort of thing. Somehow we get it done. We get it done piece by piece. The elephant in the room is about the obvious, the thing that is obvious that nobody wants to accept, which is that the health of our babies and ourselves is in our hands, and one of the most important vehicles for getting there is to be able to breastfeed for 2 years. If you can't, for some reason, if you give it a shot and you can't, and there's many things, then you deserve to have some help to get that done. You deserve to be able to get help for the last year from the breast milk bank. You deserve to be able to have relaxation, or your job give you a hand, or these kind of things. But the truth of the matter is those are circumstantial. In this room are the most powerful people on the planet. Nobody wants us to acknowledge that, but it's true. We're the most powerful people on the planet. So I'm glad to be here. If you pick up that piece of paper, can everybody pick up, do you have one of these papers? Do you have, here, pass them out. I want you to pick up this piece of paper because it is about a giveaway. So this book is coming out. It comes out for pre-sale on the 10th, and it comes out for general availability in places like Amazon and different places. It's called The Elephant in the Room. I'm going to tell you the truth. It's a little bit dense. If you have a high schooler at home, tell them to take it and do a book report from it. They'll get straight A's, okay? So attached to getting a free ebook as a giveaway, does everybody have a cell phone in this room?
Yes.
Raise your hands if you have a cell phone. Okay.
Yay.
Does your cell phone allow you to email? Raise your hands if it allows you to email. Okay. If it doesn't allow you to email, let me know, okay? And we'll figure out something else. If you send to the web address that's there, which is my web address, if you send a note to me there, I will send you a copy of the ebook when it comes out. But I will also send you a copy of the romance suspense memoir, which might be a little more fun to read, right? That called Chasing Mercury, as a companion to the ebook. So you give your high schooler the ebook about this and tell them to write a report, and you read the other one because it'll be more fun. And all you have to do is send me an email, go to the website, click contact, and type in Watts Breastfeeds. Watts Breastfeeds, okay? And it's just my name. The idea is trying to figure out the ways in which we can exercise our power. Because the elephant in the room is that the health of our babies is obviously in the hands of women who are able to breastfeed. And nobody wants to admit it, right? Governments don't. And we forget ourselves because it's so hard. So that's it. I think that's my